Hello, my name is Melissa Young. I'm a registered nurse at Mercy Hospital in Springfield, Missouri, and I want to encourage Senator Roy Blunt of Missouri to sponsor or co-sponsor Bill S-1132, the Registered Nurses Safe Staffing Act of 2015. This bill was originally introduced on April 29th of 2015. This bill requires Medicare participating hospitals to implement a hospital-wide staffing plan for all departments that render nursing services. The bill requires an appropriate nurse-to-patient ratio for each shift to ensure that adequate staffing levels are there to address varying degrees of patient conditions on each unit and allow delivery of safe, quality patient care. If passed, this bill would be a great benefit to all parties involved. Patients would receive the care they need and deserve. Nurses would not be overworked or exhausted. Medicare, the payer, would see less unnecessary costs for Medicare beneficiaries. How does this bill benefit? A study in 2009 showed that better nurse-to-patient ratios for critical patients can prevent more adverse effects and events which cost $2.2 to $13.2 million per year, where proper staffing of nurses in the same time frame costs only $1.3 million. Another study of Pennsylvania hospitals in 2012 showed with proper staffing an estimated 4,160 infections can be prevented. The study also showed that with each additional patient assigned to a registered nurse, there is an additional 1 catheter-acquired urinary tract infection per 1,000 patients, or roughly 1,351 infections per year. Another study showed that with decreased patient-to-nurse ratios, the odds of acquiring a urinary tract infection decreases by 4.25 times. A 2007 U.S. meta-study reviewed data from 94 studies, and it found that with every additional patient per registered nurse per shift was associated with a 7% increase in the risk for hospital-acquired pneumonia. And yet another study shows that with increased nursing hours per patient day, there was 25 to 26% decrease in mortality rates. Ensuring safe staffing levels will reduce occupational risk to nurses, medication and medical errors, hospital-acquired infections, and will result in better patient outcomes, fewer complications. Adequate staffing will also reduce the readmission rate significantly. So I support this bill, not only for the nurses, but also for the patient's safety and quality of care. So Senator Blunt, please sponsor Bill 1132, the Registered Nurse Safe Staffing Act, and help us registered nurses provide the best care possible to our patients.